Hello, welcome to Courageous Doctors, the new show for you and your doctor. On this show, we'll talk about Obamacare updates, other interesting healthcare stories, and health and safety tips. Now let's begin. From the New York Times, United Healthcare is going to pull out of the majority of its exchanges. It now insures about 750,000 people out of a total of 13 million on the exchanges. The Washington Post says that 12 of the health co-ops that are funded by the government have failed, costing taxpayers $1.2 billion. The New York Times mentions that Obamacare now has increased Medicaid enrollment, yet still way down from the 21 million that was projected. It's now at 12 million. New York Times says that the government will rate insurance plans on their networks and of hospitals and doctors. Now, the maximum out-of-pocket expense is up to $7,150 for an individual, $14,300 for the family. USA Today says that the high deductibles mean that only 35 cents on every dollar is now collected by doctors and hospitals. That's because people that have high deductibles, they just can't pay the doctor or the hospital either. Health and Human Service has shown that drug prices are going up, 13% increase in 2014. The Associated Press says that fines have doubled now for those who are now uninsured. So be careful about that. Star Ledger says that the New Jersey Senate is pushing for a paid sick leave bill. And the way this bill works is that you get 1 hour paid sick leave for every 30 hours worked. Now, I personally have endorsed this and, in fact, appeared with the people pushing this on another network's commercial because I feel it's so important that people should be allowed to leave work during the day when they're still fresh and they can take care of themselves, their loved ones, either kids or family members they're taking care of. And instead of having to wait till they're exhausted and go to emergency rooms at night where they're tired and then they have to go to work the next day. So I think paid sick leave, the larger companies are doing it. I think it's a good idea, and I really hope it passes. It is there on a number of cities in this state, but I hope it passes for the whole state.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Okay, let's move on to other healthcare stories. The Washington Post talks of the Zika virus. And of course, this is a huge epidemic that we're all nervous about. You know that thousands of newborns in Brazil are born with brain damage. This virus, although it's related to chikungunya and West Nile virus and dengue fever, it's different in that it attacks developing brains in the fetus and just destroys their brains, giving mental retardation, cerebral palsy, blindness, all sort of problems. And until we get a vaccine for it, which may take a year or two to develop, the only thing you can do is just use mosquito repellents and try to stay away from countries infected. We do have this mosquito in the United States, but the only cases reported so far are cases of people who've traveled to Puerto Rico, Brazil, some of the southern countries where they've picked up this virus. The government is trying very hard to do things to control mosquitoes. They have all kinds of innovative things, sending out mosquitoes that that are genetically manipulated so that they can't reproduce, and they'll get into this area and kill off these mosquitoes, having fish that eat the larvae of mosquitoes, spraying, whatever they can do. But I think vaccines are going to be the only thing that's really going to help us. Let's see. Washington Post says that in a JAMA article, which is the Journal of American Medical Association, neurology is now reporting on a blood test being researched that could pick up concussions. So stay tuned for that. The Star Ledger says that the Chipotle restaurant chain, remember the one specifically in Massachusetts, had trouble with food poisoning, and they're still under investigation for E. coli outbreaks. Washington Post, in their journal called Cell Journal, that they reported on a story in Cell Journal, says that a study showing that the glycemic index, remember that's where you see the how fast, not only the sugar level of the food, but how fast that food is absorbed after you eat it to give sugar spikes, because you don't want sugar spikes, then you get insulin surges, your sugar drops, and you run to Dunkin' Donuts or wherever. So they said the glycemic index is actually unique for each person, which is why some people can eat certain foods without feeling hungry afterwards rather than others. The Star Ledger has reported a very serious outbreak in Rutgers. 2 students have a meningitis that's the same strain as the one that was in Princeton last year, where they had to get the vaccine from London. We now have that vaccine in the country, but it's not the vaccine that's normally given to 6th graders and to kids going to college, young adults going to college. It's a different vaccine. So the Rutgers is currently trying to get their student body in New Brunswick vaccinated against this particular strain of meningitis. Again, 2 people, I believe the students did well, but an outbreak of meningitis, it's not the same strain as the one you normally get when you go to college, so it's a separate shot, and ask your doctor if that concerns you. Washington Post said there's also a listeria recall on certain frozen fruits and vegetables. So check with your grocer if that recall affects what you usually get. Good. Let's move on now to health and safety tips. In the Star Ledger, 30 Newark schools were found to have increased lead in their drinking water. You know that there's been a lot of government policy to get money to test lead in the water fountains of schools as well as other areas of community ever since what happened in Flint, Michigan. And so this was found in Newark as well, and there's a massive effort to test all the children, not only at these 30 schools, but other schools in Newark and probably all over the state and the country, and money is trying to be funded for that. The Oregonian newspaper examined a study by the Environmental Working Group that shows there's increased mercury levels in pregnant women. That's no good. Remember, you have to be careful about the fish you eat, the mercury level, especially if you're pregnant. New York Times says that the FDA, the Federal Drug Administration, wants to limit the arsenic even further in baby rice cereal. Half the tests that were done were above the limit of 100 parts per billion. Remember that the arsenic was found in the ground where rice is grown, and that's a big problem in this country. Time reports that the British Medical Journal found that 19 grams of sugar was in 40% of the juices tested, and that was the entire day's amount. So you have to be careful. The total amount of sugar you're allowed to drink might be in one juice for your kids. And lastly, Star Ledger looks at the tree pollens. You know, all of you with itchy red eyes now know that this is happening to us, and They have certain precautions, which we'll put up on the TV screen for you. Basically, limit outdoor activity, keep your windows closed. You know, you have your filter, your air condition. This is interesting. Bathe and shampoo your hair before going to bed. It has the pollens on it. Wear sunglasses, a hat. Limit contact with outdoor pets. They're bringing in the tree pollens. Change your clothes from the outside and take your allergy medicine. And that brings us to another conclusion of this week's news show. As always, we look forward to hearing from you, and we'll share those thoughts on our next show. Enjoy the weekend, enjoy the upcoming Memorial Day, and we'll see you next time.